Christian Wakeford, and do you wish to remain seated?
Greatly appreciated, Mr. Deputy Speaker. I'd like to put on record my support for Amendments 11, 12 and 13 and new clauses 15 and 16 of the Health and Care Bill, and I'd like to thank the Honourable Member for Liverpool Walton, and we've obviously heard why he can't be here today, so I wish him well with what's going on in his family today. These much needed additions are aimed at reducing alcohol harm through advertising restrictions, transparent alcohol labelling and supporting effective alcohol treatment. Alcohol abuse leads to many harmful things and deserves to be called the silent killer that it is. As chairman of the APPG for alcohol harm, we have heard in our evidence sessions the stories of those affected by alcohol. It is with potential to destroy individuals, families and wider society. Alcohol has a very public face, but it very privately harms. Hospital admissions and deaths from alcohol are at record levels and have been exacerbated by the COVID-19 pandemic. Around 70 people die every day in the UK due to alcohol. Alcohol harm is a hidden health crisis that needs to be recognised. The Health and Care Bill presented to the House today does not go far enough to stem the rising tide of this issue. For instance, Mr. Deputy Speaker, as it currently stands, the bill introduces restrictions for advertising of less healthy products, such as sugary soft drinks, yet the same restriction does not apply to adverts for alcoholic drinks. This is despite alcohol being linked to more than 200 health conditions, as well as having a very high calorie and sugar content. In regard to advertising, there is significant evidence that children who are exposed to alcohol marketing will drink more and earlier than they otherwise would. Existing laws are failing to protect children and vulnerable people. In fact, 4 in 5 11 to 17-year-olds have seen alcohol advertising in the past month. The advertising they are exposed to builds alcoholic brand awareness and influences the perceptions of alcohol. A forthcoming report by the Alcohol Health Alliance found that 7 in 10 young people recognise the beer brand Guinness, including more than half of 11 to 12-year-olds. Amendments 11, 12 and 13 to the Health and Care Bill would ensure that alcohol is considered a less healthy product and therefore liable to the same proposed restrictions on advertising as sugary soft drinks on TV, on demand and online. Secondly, Mr. Deputy Speaker, awareness about the risk of alcohol is low. About 80% of people do not know the Chief Medical Officer's low-risk drinking guidelines of 14 units a week. Only 25% are aware that alcohol can cause breast cancer, and only 20% know the calories in a large glass of wine. Mr. Deputy Speaker, I only need to refer you to the Six Nations Championships earlier this year, and obviously you may have a slightly better recollection of those than I do. But when we saw alcohol advertising on billboards around the stadiums, many were advertising alcoholic brands, and when there was drink awareness campaigns, they were there, but they weren't seen because it was the placing of the advertisements, which made it much more visible for those who were seeing brands for Guinness, but not Guinness Zero, or for drink aware campaigns. So I think this is something that the government really does need to look into. New Clause 15 requires the Secretary of State to introduce secondary legislation on alcohol product labelling. Consumers have a right to know what is in their drinks to make informed choices about what and how much they drink. However, currently there are no legal requirements for alcohol products to include health warnings, drinking guidelines, calorie information, or even ingredients. Research by the Alcohol Health Alliance found that over 70% of products did not include the low-risk drinking guidelines, and only 7% displayed full nutritional information, including calories. The government's forthcoming consultation on alcohol calorie labelling is welcome. However, more needs to be done to ensure other health information is provided on labels too. I know many companies are already looking at having e-labelling so that anyone with a smartphone can access the information online, and whilst this is a very welcome step, we do need to be doing more. Lastly, Mr. Deputy Speaker, alcohol treatment services are essential to support recovery for those with alcohol dependence. Pre-pandemic, only 1 in 5 dependent drinkers were believed to be in treatment, leaving a shocking 80% lacking help. My own brother was one of those, and unfortunately 6 years ago I lost him to alcohol dependency, which is why I take this matter incredibly seriously. New Clause 16 would require the Secretary of State to report on the ability of alcohol treatment providers to offer support and reduce alcohol harm and the levels of funding required. Low levels of access to alcohol treatment are largely due to insufficient funding, and since 2012 there have been real-term funding cuts of over £100 million. an average of 30% per service in England. Alcohol treatment is cost effective. Every £1 invested in alcohol treatment yields £3 in return, rising to £26 over 10 years. Recovery also yields powerful dividends for families affected by addiction. In conclusion, Mr Deputy Speaker, the bill needs to go further than it currently does to include evidence-based measures to reduce alcohol harm, and I encourage members across the House to support these much-needed amendments so we can tackle this silent health crisis that is affecting so many of our constituents.